Dr. Mitesh Patel, thanks so much for doing this.
You're very welcome. Happy to be here.
The interesting thing about the field you work in, I feel like there's a lot of misconceptions. And as someone who's not in the world of psychiatry, what are your biggest misconceptions you have to deal with when it comes to mental health and psychiatry?
I'd say the biggest one is that there seems to be a societal kind of view of mental illness as different from medical illnesses. So um, people often tell me that their depression is not a medical illness or their anxiety is not a medical illness, but there's tons of evidence to say that these are medical conditions similar to diabetes or hypertension that definitely need treatment.
What misconceptions do people have around what it means to be mentally well?
That is a great question. Um, I'm not sure how to answer that. I think there's societally a lot of misconceptions around happiness. I think we all want to be happy, and I think that is a lofty goal that we all have. Or I think when I ask patients, what does happiness look like for you? It's hard for people to define what that is. And so even when I prescribe antidepressants, people will tell me, well, aren't these happy pills? I was like, no, these are antidepressants. They are meant to improve your depression. Happiness is a whole nother category, whole nother issue. So I would say that I think people look for happiness. I think I'd rather them shoot for contentment, if that makes sense.
Mm. Yeah, it's funny because one person's happiness looks completely different to someone else's, and so I guess your job is, and sort of make a question up on the fly. How much of your job is managing expectations?
Oh, geez. At least 50%.
Really? Wow.
Yes. Yeah.
Wow. I think it's a funny thing of 'cause, I mean, on this podcast it's preventative health, social health, and emotional health, but inevitably we were just talking before. There's this lovely book about investing called The Most Important Thing, and chapter 1 starts the most important thing is, and chapter 2 starts the most important thing is, and it goes through. Inevitably they're all the most important things, and you can't take one piece and not expect it to be tied to anything else. And the mental side of how one could label themselves coming into your office, of being like, okay, I want to be happy, but yet I guess you're just trying to establish the ground rules of like, okay, first of all, what is your version of happiness, and how can I actually realistically help? How do you manage those conversations when you're working off a different vernacular of what happiness is?
I think it definitely depends on what the patient is going through. Like if they're, experiencing severe depression or anxiety, I think the goal is number one to improve the symptoms of depression and anxiety more so than achieving happiness. But although that is something that may happen kind of later on down the line. Um, I would say I think a lot of patients. Oh, sorry. I think
No, that's great.
a lot of patients kind of may have a lot of predisposing issues like trauma, substance use that kind of prevent them from actually achieving, the goals that they want and maybe in turn feeling happy. So I think
Okay.
a lot of it is kind of helping people, number one, find the right medication, number two, make the lifestyle changes that they need to feel their best.
Right. Okay. So it's almost, when people come into your office with depressive symptoms, it's, as opposed to like an attack or like an offensive strategy of let's get you happy, it's defensive of let's remove all the things that are preventing that, and then maybe downstream of that happiness can come.
Absolutely.
Okay, wonderful. That's a nice that sounds like a pretty fulfilling job at times, I imagine.
Yeah, it's really amazing when people respond well to medications or even respond well to lifestyle changes and they are feeling better and doing better. It's really interesting to me how things really fall into place. So I think community is really important, sense of purpose. And I think as people are feeling better, they're always telling me about how they're, getting reestablished with old friendships, old communities, their religion. They have a sense of purpose. Maybe they're volunteering. I have a patient that is in recovery himself and hands out clean needles, that needle exchange program. So like stuff like that really impresses me. Really makes the job really rewarding. And I always love to hear those stories from my patients because it really makes the job worth it.
Let's double click on sense of purpose, because I think if someone was to click on this episode, maybe not your obvious rabbit hole from someone who works in the psychiatric field,
Mhm.
How important is a sense of purpose, and how do you work with people to try and foster that?
I think very important. I think people who, a good example are people who maybe are, for whatever reason, unable to work, and maybe because they can't work, it's hard for them to fill their day with things that provide them purpose. But I would say that people that have the most sense of purpose get it not just from their job. I think they have other things like volunteering, charitable organizations, causes that they're really passionate about. I think those are the things that really give people a sense of purpose and belonging.
Mm. And a piece of sound mental health is uh, being part of something bigger than just yourself,
Absolutely.
um, which I imagine having a sense of community and a sense of purpose fosters. So I guess how much of mental health is too inwardly focused, and is part of your goal trying to get people to be a bit more broader in their perspective?
Absolutely. I think in our modern age, right, our internet, cell phones, computers, I think we're more isolated than ever. And I think just thinking about also, particularly in America, the shifts of people from smaller towns to urban cities, right? So the people went from places where they probably had a decent sense of community because the community was smaller to larger areas where I think we're a little bit more separate. um, I think naturally people have lost that sense of community. But I feel when people reestablish with their community, or reestablish with a cause that is passionate to them, I definitely think that that helps with that sense of community. And it's
Mm.
a challenge too with the internet, right? Because a lot of times the community is the people that you meet on Discord, or playing Call of Duty or something like that, which is not necessarily a bad thing. And I have many patients who have, their only friends are online, which is not a bad thing. But in a perfect world, I think it would be a balance between like online or in person interactions. But I think what I heard you say earlier is like the societal balance, or that desire to have a balanced lifestyle is not as important in this moment in time. And I think Gen Z is a great example of this. Gen Z is really about that work life balance. And not only that, when they look for jobs, they look for jobs that align with their culture and their values. And I think a lot of older people kind of look at that and they go, oh, Gen Z is so inflexible and they want things a certain way. But I actually really appreciate that. I think that's kind of where our society needs to go, and that we do need to have a better work life balance. We do need to, when we're working somewhere, yes, it's a job, but it should also, make like be aligned with what we want, what our values are. And so I think I'm seeing the pendulum kind of shift towards the balance, and I think the younger generations are definitely helping with that.
Yeah, definitely. It's funny when you think about mental health and your obvious no-nos of drugs and excessive booze and whatever it is. Gen Z seem to tick a lot of boxes for sound mental health. They drink less than ever. They, as you said, they seem to foster more of a sense of well-being and balanced lifestyle. I also read the other day that um, they have a cohort of people that are moving against smartphone technology, and actually they opt to use a dumb phone for a lot of the week, as opposed to a smartphone.
Yeah.
Yet it doesn't seem that their rates of mental health are any better than millennials or boomers or other generations. Why do you think that is?
That is a fair observation that I've also made. I don't know. I think it's got to be. I feel like it's got to be our time, and then I think when they're coming of age and kind of the events that are going on. So I'm a millennial, and I grew up in the '90s, which were, I think, the greatest time in American history, probably. I bet every generation says that, but I think Gen Z is starting to see, with the rising cost of living, housing. I think they're starting to see like what their yield is in terms of their investment into their education or their career. And maybe they look at their parents and they say, I don't want that. I don't want to work, 40 hours a week for the rest of my life for, to barely, make a living. And so I think there's this desire to change the status quo. I think changing the actual status quo is difficult, and I think maybe that is what kind of keeps Gen Z possibly where they are. That being said, I have many Gen Z patients that I learn a lot from, just in terms of their philosophy, their interests, and I really think Gen Z as different as they are as maybe millennials or Gen X or Boomers. I definitely think they have a lot of promise in terms of the ideas that they have, like you mentioned.
Yeah, I agree. I think there's a line that I like, which is how you keep score determines how you play the game. And I think when people look at Gen Z as a cohort, they don't get them. They're like, well, I don't understand why you would opt to live not in a city and not optimized for career progression. And actually, it's just you're just two schools of people playing two different games. Um, with I want to jump into sort of preventative mental health, which I have no idea is even a term, but we spend a lot of time thinking about preventative health, physical health. When people step into your office, there's often an issue at present, right?
Right.
How important is having a preventative mental health approach, and what would be things to foster that, if that is something?
I think it's extremely important, and not. I don't think it's something that we've really looked at a lot in medicine, or even really recommended to patients. But more recently, now in schools, so where I work, we have a school-based kind of program, mental health program, and they do kind of educational sessions that talk about identifying emotions, managing feelings at a very young age. And I think that's very, very important to, number one, have the ability to label an emotion, manage that emotion. And so I think preventative mental health starts, very early in the developmental period. Now, as we become adults, it becomes more challenging. There's the demands of work, school, relationships. And so I think if you have that foundation, then I think it makes stressful situations a lot easier to manage. I guess what you're asking is like, what can we do preventatively, maybe as adults, to improve our mental health?
Yes, but interesting that being familiar with sort of, I guess, introspection and acknowledging what you're feeling at a younger age can sort of, I guess, strengthen that muscle. But yeah, as adults, what can we do?
Oh, that's a great question. I think one thing that I'm a huge proponent of exercise. I exercise a lot myself, and there's interesting meta analysis that came out. I want to say this year or last year, that found that moderate levels of exercise, definitely have a positive effect on mood. And I think exercise has a slew of other, benefits for our physical health. So I think some sort of movement, it doesn't have to be running or weightlifting or anything like that. It could be just going on a walk, or it could be, playing with your dog, something like that. I think movement is very key for people. And I think the more sedentary we are, the worse our mental health gets. So I would say, incorporating some kind of movement into your daily routine is very, very important.
For sure. I think everyone can sort of know that intuitively, anecdotally, in their own experience, or just, I guess, being out with friends or whatever it is. Everyone sort of gets that. But sometimes I think when you're in that mental funk, it's quite hard to feel motivated to change your physical state. Um, but yeah, often it's like, is it a software problem or a hardware problem? And the hardware problem usually solves the software problem. Um,
I like where you
easier, yeah, easier said than done. You mentioned labeling, which was I thought was interesting. I sort of had something prepared on this, which was there's a line that we came across, which is the limits of our language affect the limits of our world, and we were thinking about this from a mental health and psychiatry point of view. I've heard of this massive book of different psychiatric illnesses, and apparently, if anyone flicks through it, they'll find a handful that they could sort of self-diagnose themselves with. With easy access to the internet and the potential for self-labeling, how careful do you have to be when talking about labeling and people identifying it with their own mental affect?
It goes both ways. I have patients who are struggling for a long time, and I'm trying to help them understand what their diagnosis is or their label. And the reason for that diagnosis and label is to help them get connected to treatments that show that can improve that diagnosis. Now, on the opposite end, I have patients who are doing okay and may have a spectrum of behaviors that are, in my opinion, within just the natural variability of human behavior, and they're looking for a label for that behavior. And in those situations, I'm not sure how helpful it is. And I even tell patients, the book tries to fit us all into these neat little categories, and I think there's 8 billion of us on this earth, and it's very unlikely that all of us are going to fit into these neat little categories. So I think there's value in the label, and there's also some potential harm in the label.
Mm, that's interesting, really interesting. I think, yeah, I can see how that cuts both ways and can be a bit difficult. Um, with your personal story is quite interesting. Can you tell us about your van and
Uh,
your relationship with social media?
yes, so during the pandemic, I was watching a lot of van build videos, and I got an idea in my head. This is actually right before the pandemic happened. I bought an old van that I wanted to convert into a camper. And so I have no automotive woodworking experience, but I figured, people on YouTube do it, so I could do it. And it was actually a really great experience. It occupied a lot of my time during the pandemic. Helped reduce my stress. I got about 70% of the way through the project before the van died, and I had to scrap it. But I still see it as a success. It did cost, a fair amount of money, but what I learned from that experience and just the experience itself, the memories I have of sitting in my garage, for hours till midnight or 1 in the morning, just listening to podcasts and working on my van, were, some of the more positive memories I have of, 2020 or 2021. That being said, my original plan was to take my van and drive around country and do telepsych. Still, I would like to do that. I'd need to start with a better van probably to begin with. But that's kind of what I wanted to do. And then so once that van kind of died, I ended up moving back to California to where I grew up. And I think that's been a very positive change for me, kind of piggybacking on that idea of community. My entire family is here in Southern California. And I find myself just so much happier and so much more connected to my surroundings than when I was in the Midwest.
I think that's what the pandemic did for most people. It popped the bubble of, oh, okay, we really need social connection. It's almost, you have an absence of something, you really appreciate the value of it. And I think across the Western world, at least, I can't speak for the Eastern world, but that bubble has completely popped. And I think people are trying to foster in community and social connection consciously as opposed to unconsciously before.
Absolutely.
Um, yeah, it's interesting. So, and tell us about your relationship with social media.
I don't have social media. I mean, I think I reactivated my Facebook to sell something on Facebook Marketplace. But outside of that, I try not to spend much time on social media. I do consume TikTok every now and then. That's because I find it very educational. But outside of that, I try not to stay on it. And that's because I think, there's many studies that have shown that social media can affect your mental health. And I just find that I worry less. My day to day is a lot easier when I'm not on social media. So, and as much as I can, I prescribe social media diets to people. People are going through breakups. I was like, you have to put down the social media, maybe block that person that you broke up with, give yourself some time to kind of reorient to your new reality. So, well, I think social media is great. And, I think the older generations have found it very helpful to reconnect with people that they've lost touch with. I think there's, again, kind of that idea of balance, right? I think there's a lot of people that may spend far too much time on social media. One of my favorite Gen Z phrases is called doom scrolling, which I think is a great description of just just mindlessly like consuming social media.
Yeah, I mean, it's a really scary. It's scary. I mean, we're in London, right?
Mhm.
And you step onto the tube in the morning, and I play a game of how many people I can count going down one side of the tube who are all just on their phones scrolling. I think my record's something like 56. I just walk down, just counting like, yeah, it's ridiculous. And everyone's felt that pull of doom scrolling and felt that pull to the phone. I mean, it's hard to be balanced when you've got something so addictive in your pocket.
100%. I think, cell phones are useful tools, right? Or smartphones, keep us connected to our work and our, social lives. But, I think it comes with a downside in that, and I think this is not entirely people's fault. I think social media apps themselves are designed to be somewhat addictive, right? Every time you refresh your Instagram feed or your Facebook feed, there's some new content that pops up, and that's by design. It's not like when you refresh it, it's the stuff that you've already seen. And so I think that kind of keeps us, keeps that dopamine reward circuit activated and keeps us kind of fixated on the social media. And then TikTok in particular, these are videos that are 15 to 60 seconds long. I know they have longer form content, but that's, that is, it really captures our attention, in that 15 to 60 seconds. And then we keep doing it over and over again. And I wonder, what are the long-term effects on our cognitive functioning, attention, concentration, by spending so much time with those kinds of social media.
Me too. Me too. I mean, I feel like I think everyone can slightly relate to a time where they had a longer attention span.
Hmm.
I mean, I've really tried to sit with a book for, a couple of hours and fight that urge to just not leave or not do something else and actually just sit with it. And it gets harder with each year with, I don't know, just pull to the phone or whatever it is. But I feel like I'm swimming against the tide here. Have you heard of a book called Addiction by Design?
No, I have not.
Oh, not Addiction by Design. It's called, sorry, I forget the name of it, but it's about the casinos in the early days and how they're structured from like a behavioral point of view to be really, really addictive. And they were saying that essentially the most addictive machine in the casino was the invention of the virtual slot machine. And you went from it was pretty addictive, the, mechanical slot machine before, but the implementation of the virtual slot machine became the most addictive thing in the casino because you could have a game of roulette, whatever it is, or, pull the wheel or thing that plays the game. And off the back of that, you can play so many more games in such a shorter period of time. So the term they used was event frequency was shorter. And for
Right.
me, as soon as I read that, I thought, oh, that's just the same with these short form content. It's like you've taken a YouTube video and you've reduced the event frequency down where you can watch more in a shorter period of time, be it TikTok, YouTube short, or an Instagram reel. And it's almost like hacking our wiring to be so unbelievably addictive that it can't, how could it not rewire your brain in some way to ruin your attention span?
Yeah, if we look at it from a behavioral perspective, the the video or the casino, the winning the machine is like a reinforcement, and the most effective form of reinforcement is a variable ratio, meaning that it doesn't happen every time you pull the slot machine, but it happens at some random interval, and that tends to reinforce a behavior the most out of all kind of reinforcement schedules. So I 100% agree with you that I think it's the repeated kind of gratification that we're getting that kind of keeps us addicted to our devices or social media.
What's the solution? What do we do? How do we have balance?
I think, personally for me, I found myself, especially in the last couple of years, probably just like sitting on my watching TV and then sitting on my phone. And so I make a conscious decision to put my phone in my bedroom and then I sit downstairs and I watch TV. And I think we have to make conscious decisions to not be on our devices. And then sometimes I'll recommend an app, which I think it's kind of odd that I'm recommending an app to keep people off their phone. But there's an app called Forest, which is cool. It helps grow a tree the longer that you are off your phone. And I've used this before too. It's surprisingly gratifying. The more you stay off your phone, the more this little tree grows. And so that kind of helps. There's apps that help limit how many times you can pick up your phone in a given hour. So in a similar way that or behavioral reinforcement has got us addicted to our phones, we can kind of undo that by performing a similar kind of behavioral reinforcement on ourselves.
Yeah, it's sort of it's like a jujitsu move. You're sort of using the same thing back against it. Do
Exactly.
you do you think sound mental health correlates with low screen time?
Screen time, I don't know of any studies in particular, but I do know, in adolescence, we know that the adolescents who spend more time on social media have a higher risk of depression, suicidal ideation, that feeling of FOMO. So I definitely think, just kind of extrapolating the evidence, I would assume that there's definitely a link.
Mm. I mean, there's this. You probably come across this study. There was one that came out recently this year, which is the impact of screen time on sleep patterns in school children.
Oh, yes.
Um, February 2004. I mean, a quote from it is: "Escalating screen time is correlated with detriment, detrimental impacts on sleep efficiency, dream recall, physical activity, circadian rhythms, and academic performance." Um, and what kind of goes back to your point earlier, like what are the long-term implications of that? I mean, a developing brain exposed to that much, like it's cheap dopamine, it can't be good.
Well, I think also just the blue light coming from our phones, right? That impacts our ability to fall asleep and stay asleep. I think is also a huge impact. And I think kids are now get their devices at a younger and younger age. I think I got my first smartphone like in my mid 20s, but nowadays, kids are getting them much younger. And yes, I absolutely understand that. And I don't know if it's the sleep deprivation, if it's like the attention issues that happen with devices, but I can definitely see a long-term effect of screens on people.
Mm. Yeah, it's interesting to see how it plays out. Speaking of screens, in your work, you do lots of online consultation, if I'm right, and some in person. Is one better? How do you manage that? And just how do you think about that sort of balance?
I prefer in person. I think I get the most information when I see a person. When I get to, get them from the waiting room, walk them to my office, watch them sit down on the chair. There's information that you may not think that I'm thinking about or looking at. That I get a complete picture of the person in an in-person appointment. That being said, our telehealth model has really allowed access to patients that I think I would have never seen. I have a lot of patients who are unhoused, who are in recovery programs, and maybe they're just not able to get out of where they are, or they have transportation issues, they can't get to an appointment. And so while telehealth is not ideal, there may be some missing information. I definitely think it allows us access to people that may not have received quality psychiatric care before.
Mm, yeah, I can see that for sure. I mean, is there any new technologies that are influencing, I guess, mental health care in any way that you're excited about? Or
Yeah, there's lots of things. There's actually yesterday we were talking about a VR therapy program. So it's like an Oculus kind of device, and there's several different companies that are doing this. But they're doing therapy virtually via this VR kind of platform, which is really interesting to me because I'm a big fan of technology, and particularly CBT is pretty rigid. I don't mean that in a negative way. Rigid and structured kind of therapy. It kind of
cognitive behavioral therapy?
Cognitive behavioral therapy, exactly, lends itself to kind of a computerized model because it kind of goes through an algorithm. And CBT has a ton of evidence for improving depression and improving anxiety. It's probably one of the modalities of therapy that have the most evidence behind it. And so I think virtual therapy is really interesting to me, especially where people may not feel comfortable talking to a therapist one on one. Perhaps maybe they feel more comfortable doing kind of virtual therapy or something like that. And not only that, there are virtual therapies for low back pain. So there's a company out there that has a device that doesn't actually physically implant anywhere, but by doing this program, it actually reduces the severity of back pain.
Wow, that's
Yeah,
pretty cool.
yeah,
I can see, I can see the idea of some sort of VR gradual exposure therapy through that as well. I mean, I don't know if that's a thing, but I can see
like
how that could be.
for PTSD, like prolonged exposure therapy in a VR setting would be very, very helpful, right? And to reduce like hyperarousal symptoms or avoidance in the context of that disorder.
Yeah, right. Interesting. So, just sort of zooming out again. I mean, you've been doing this for a number of years now. I think it's a really interesting lens to sort of learn about humans and what it means to live well as well. Like the extremes, good or bad, teach the best. What have you learned directly from the field of psychiatry that has shaped how you actually show up to life in a different way?
I think my biggest lesson is just the resilience of humanity. Just people going through really terrible things in their lives or growing up in disadvantaged situations and really making the most of it has really been something I've been like in awe of. I hear from patients that just have had really, really rough childhoods or rough things happen to them, and they really worked hard to surmount those challenges and make the most of their present situation. And so I think that's one thing that I've learned personally from doing my work on a day-to-day basis.
Yeah, well, love that. It's I mean, we said before, so it sounds like fulfilling work when it goes right. I'm sure. Um, And yeah, I mean, as anyone navigates through life, they often meet people who have suffered from some sort of mental health issue themselves, or friends. And I think more conversations like this, the better. It fosters, I guess, being a bit open about it and realizing you're not the only person in the whole world going through what you're going through. Right? Someone might look a bit different, but there could be a like for like. Which I think there's something in knowing about that someone else is going through the same thing that can soften the blow a bit. I think. Um, the area I want to go next is a little different. It's where do you see sort of the future of psychiatry going and mental health going?
It's a great question. I think psychedelics are definitely new on the horizon, and what's interesting about psychedelics, and I'm not saying I recommend them. I don't think we have enough evidence to recommend psychedelics at this time to treat depression or anxiety, but these things are in phase 2 or 3 trials with the FDA. But with the studies, what sticks out to me about these studies is the amount of drug exposure to help with recovery. So usually these are looked at in the context of therapy. So psilocybin assisted psychotherapy or MDMA assisted psychotherapy, to where people will have a preparatory session and then an actual session with the drug, which involves like a guided trip or a therapeutic session. Um, what's really interesting, it takes 2 or 3 of these sessions to create meaningful improvement that is similar to current medications that we prescribe, sometimes better. Now, these are small trials and there's lots of exclusion criteria for these patients, but I think that's really interesting that just 2 or 3 exposures to this drug versus taking Zoloft every single day creates similar effects. And one of the studies found that some people did not meet diagnostic criteria for, say, PTSD after 2 or 3 of these kinds of sessions. So I think that's really, really interesting. And then psychedelics themselves are just fascinating to me. I think it's almost simulating that spiritual experience that maybe we all need to heal. And I think that's one of the theories as far as how psychedelics work to create positive change.
Well, I mean, so just sort of psychedelics in the UK is probably means something different to psychedelics in California. I don't know. When you say psychedelics in a clinical setting, are we? And you mentioned MDMA, you mentioned psilocybin which is the active compound in magic mushrooms, if I'm not mistaken.
Correct.
Are those the main two being pursued or being
There's
studied?
traditional psychedelics or they're serotonin agonists. Those are psilocybin, LSD, and dimethyltryptamine or DMT. Then there's psychedelic adjacent kind of thing. So MDMA is not necessarily a psychedelic; it's more of an empathogen. And then there's ketamine, which is a dissociative anesthetic. So not necessarily psychedelics, but psychedelic adjacent. But all of these compounds have been studied for the treatment of depression. Psilocybin, to a lesser degree, LSD, ketamine, and MDMA have a lot of promising studies behind it.
That's interesting. I've read Elon Musk had some ketamine therapy
Oh,
recently. Yeah, I've also heard about with ketamine. It's as you said, it's dissociative. So if you were to go through a traumatic event, ketamine soon after apparently can help that trauma not be as traumatic. Apparently, is that true?
there are studies that have looked at the largest body of evidence for ketamine is for depression, but there are some studies that have looked at ketamine for PTSD. Theoretically, because it's a pro-dissociative agent, it can increase the symptoms of dissociation depending on the dose. So ketamine is sometimes mostly prescribed in infusions or nasal ketamine, and then they even do sometimes oral ketamine. And those are kind of therapeutic doses of higher doses. Then there's microdosing ketamine or ketamine-assisted psychotherapy. In those cases, especially when processing a traumatic event, one of the side effects could be dissociation. But over time, if the ketamine is indeed treating the disorder, then we can expect, a decrease in the frequency and intensity of dissociation over time.
Okay, right. It's really interesting. I think there might. I know in the UK there probably had to be quite a lot of cultural shifts to take place for that to be mainstream.
Mhm.
What's it like in over where you are in California?
It's been part of our culture, I feel like, for a couple decades. But it's really interesting. So I have a lot of patients that are California sober, meaning that they don't drink alcohol, but they do everything else. Which I think I don't necessarily disagree with. But it's just I think there's in California in particular there's a lot of societal acceptance for these things. On both extremes of the East Coast and the West Coast, I think there's a lot of people exploring these things as like first line options for treating their conditions.
Well, they pop the status quo of booze because it's legal must be way healthier than what's illegal, right? And I think in the UK, drinking culture and binge drinking culture is so normalized from a really early age. 18, you can drink here. Your whole uni experience is very much centered around a very drinking heavy experience. And I mean, the research around alcohol and sound mental health is not promising.
No, I would say alcohol is probably one of the more damaging things to our mental health, right? And I think the issue there is we can get alcohol anywhere. Whereas, I think going backwards to when cannabis or when a lot of these things were labeled Scheduled One drugs, I think it was the Controlled Substance Act. I want to say it was somewhere around the 60s or the 70s, and then because of that legislation in America, we saw a sharp decline in research looking at psychedelics or marijuana or any controlled substance that was considered a Schedule One drug. And I think we're seeing that pendulum kind of shift the other way now to where just last week, the DOJ was talking about rescheduling marijuana to lower than Schedule One. And so I think it's maybe just like our societal view of the substance kind of changing, and then maybe legislation kind of following in the background.
Mm. I think it takes a lot of weight for these things to be suddenly common in medicine. And I mean, in the UK, it's hard to imagine a UK where psychedelics are a normal thing prescribed by your general practitioner or whatever it is. But that's the kind of change. If there's evidence there, right, then it should go in that direction. What is nice is that there is a movement away from like a very alcoholic, central alcohol fueled culture in the UK. I mean, non-alcoholic beverages on the rise. People like to do other things as opposed to just drink all the time. And yeah, I think those contrasting cultures, America, UK, are a bit different. We're not quite as liberal with California sober. Yeah.
And to my knowledge, there's no recreational cannabis or even medical cannabis in the UK.
No,
right?
no. So there's medical cannabis in California, right? That's a thing you get a prescription for.
There's recreational and medical cannabis.
Right.
Yeah.
Okay.
So medical cannabis, you don't pay the taxes, and recreational cannabis you do, but there's basically no difference.
Right. And what conditions would warrant medical cannabis?
In my opinion, there's very few, and part of that is we don't have enough research on or quality, high-level research on what conditions cannabis can treat. The little research we do have finds no effect or a non-statistically significant effect. So they've looked at cannabis for pain or for anxiety or for sleep. Not a lot of high-quality studies though, too. So hopefully as things change with scheduling, with those substances with the DOJ, I'm hoping that more high-quality research comes out. I I did attend. We have like a national convention of psychiatrists, so I went to the one last May in San Francisco, and I got to see two kind of experts in cannabis or psychiatrists that are experts in cannabis, and they were saying CBD probably has the better evidence in terms of safety because it's not as psychoactive. Excuse me. And they've recommended CBD for like anxiety or sleep, but those are the experts. So I think we're still a far ways from general psychiatrists like me recommending cannabis to treat any condition.
Okay. So if it was like a pyramid, right? Starting with sound foundational principles, like universal things we can do. I mean, you mentioned movement, you mentioned exercise. I think people know about sleep, social connection. If we just sort of go up the pyramid of things of like what we can actually do to foster sound mental health and actually ward off any sort of psychiatric event, perhaps. What would you add to that pyramid? And then sort of maybe towards the end, things that not necessarily you recommend, but you're excited about learning about more. So the research might not be there, but you would if you could click a button, you would uncover all that research, I guess.
I think in addition to what you said, balanced diet. So we know that the Mediterranean diet, for whatever reason, it's very high in antioxidants, tends to be the diet that can improve mood symptoms or anxiety symptoms. So I would say, and it doesn't even have to be Mediterranean. I think just having a balanced diet that incorporates a good spread of your macros, I think is important. In terms of other things that provide a sound foundation for mental health, I think faith is important for some people. I think for some people it can be very traumatic. So it really, really depends on the person and where they are. But I think, as long as religion or spirituality aligns with your worldview, I think leaning into that, using it as a source of strength and using it as maybe a place where you're having a sense of community as well, I think is very, very important.
100%. I definitely think, I mean, there's that lovely book called The Good Life, which is off the back of one of the longest studies ever done on human happiness. And, the conclusion is it's about the quality of connections. And I think, people are way more open to that these days.
And then, go ahead.
Oh, go on.
Oh, I was going to say, just like you said, making sure people have so regular social interaction. And for some people it can be hard if you've grown up and it's been hard to make friends. it can be very difficult to get out there and be social. But nowadays, in our internet age, we have things like Meetup. We have various kind of online platforms that provide a way for people to meet in person. And as long as people do it safely, I think that's a great way to kind of explore those social connections.
So in the UK, we have a Minister of Loneliness.
Oh, really?
We do. And the NHS, which is our massive governing body of health,
Mhm.
have started prescribing social connection, which is great. And it looks different. It's really cool. It looks different in all sorts of forms. But there's a town called Frome. And in Frome, there's a bench where a GP will go and sit on. And it's sort of like come at this time. I'll be here from 12 till 4, whatever it is. And this is a time to come and meet people and just be social.
That is awesome.
Um, it is really good. I think it's a great step in the right direction of, what does this new age of health look like? And I think it's quite progressive for the NHS, which is a lovely thing. Do you have anything like that in the US?
No, unfortunately, we don't. I wish we did. I would happily write a prescription for social interaction if I could.
Yeah, it's interesting. There's another one I read where in Japan, it's not uncommon to prescribe a walk in nature.
Hmm. How interesting.
It
Yeah,
is, isn't it?
a lot
Just
of yeah,
yeah, like alternative things.
yeah.
Um, just to get ones at end, which I quite like asking is, what are you excited about at the moment?
In terms of psychiatry or just in general?
Take however you want.
What am I excited about? I'm excited to see kind of how society will change in the next 10 to 20 years. Again, I think Gen Z is going to have a heavy hand in that, but I'm thinking we're going to go to a 4-day work week, maybe more balance between work and our social lives. So I'm really excited to see how the new generation kind of changes our society or our societal view of work of our lifestyles, and I think I'm excited to see how that balance, how we maybe strike a better balance between our work lives and the other parts of our lives. I think we're at a point where the pendulum is shifting towards the middle, and I'm really excited to see how it settles in the middle.
Yeah, I share that. I've got a thing Eloise and I speak about a bit, which is we feel like the last 15 years or so, it's been this push where everything is going online. Everything is going online and it's pushing like IRL or URL, right? And I feel like everyone thinks it's a trend that only goes one way, but actually it seems more cyclical. And now there's this pushback the other way of actually, I don't want my smartphone all the time. I want to meet up in real life. I want to do things properly. As we sort of mentioned, this shift back to our sort of ancestral roots. And it seems, yeah, I agree. Gen Z seem pretty harsh on all that stuff
Yeah,
for sure.
it'll definitely be interesting to see, hopefully if we're able to strike that sense of balance. But I can definitely see that pendulum swinging the other way. I think one thing I'm concerned about is just VR. I mean, Apple Vision, awesome. But it kind of brings to fruition just like a lot of sci-fi movies or books that I've read where people are like interconnected to their the internet or their electronic environment that's augmented reality with their world environment. I think that could definitely kind of shift that pendulum the other way to where maybe people don't want to spend less time on their phones or that sort of thing.
That film Her comes to mind. Have you seen that?
No, I haven't. I was thinking of. Have you seen Ready Player One?
I've heard of it. I haven't seen it or read the book, but apparently, I know it's quite big in I guess Silicon Valley and sort of
Yes.
among that crowd.
Right.
For the listener who hasn't heard of it, what happens? What's the synopsis?
Ready Player One is about a society that's basically exists on like an online gaming platform. So people spend most of their lives, get their recreation on this online gaming platform, and it's actually interesting. People have a sense of community, and there's lots of things to do on there. But obviously, it's fraught with issues, and the system is somewhat oppressive and takes advantage of people. So it's a really interesting book, and they actually came out with a Ready Player Two, which is a sequel.
Okay, right. I mean,
Yeah.
the thing is, science fiction. It sounds like it'd be in the category, but it doesn't seem that far off,
No.
and you could sort of get there, right? It's yeah, it's interesting how technology will play a role in mental health over the next few years. And yeah, I think the balanced approach seems to be the one, but hard to foster.
Right. Absolutely. It's like technology is an enemy, but also a, a solution. So it's like balancing those two things.
Yeah, for sure. Well, I don't have an answer. I mean, I battle with it where I have been saying for the last like 3 4 weeks I want to try and get a dumb phone, and my default would be I use the dumb phone most of the time with my smartphone turned off, and then a couple of hours each day I'll turn my smartphone on because I like a podcast, and it's not all bad, right?
Yeah,
Um, but currently having my smartphone isn't working for me. I need to find some sort of different alternative. Just to feel like it just absorbs so much time that could be spent on other time. It's the opportunity cost of time which gets me, which I don't like.
yeah,
Um, and I think a big part of mental fulfillment, and as I see it, not that I'm some professional at all, but I think it comes through fulfillment. And I think if you're just on the shallows all the time and not getting into the depth of anything, I think it's quite hard to have that.
absolutely.
Yeah. I mean, actually, would you agree with that, or?
Yeah, no, I do agree. How do you envision? I guess my question is there an intermediary between a smartphone and a dumb phone?
My answer to that was, but is have both.
Have both. Okay.
Yeah, because I can't be uncontactable,
Right.
but I mean, there's a small core group of people I'd love to be able to just have my, dumb phone number, and I'll pick up all whenever you want. But I don't want the Instagram, I don't want the Twitter, I don't want the checking this or checking that on my email, or just space from the doom scroll. So maybe that's a middle ground. I don't know. I'll let you know. Maybe I'll do an experiment next month, and I'll
I think
let you know how I go.
you're definitely more courageous than I am. I haven't taken that step to get a dumb phone because I think it would be very difficult. I imagine it was very difficult to adjust to, kind of primarily using like a non-smart.
Well, I've done it before where I've just got rid of the smartphone. I haven't done like the hybrid thing.
Okay.
But the problem is, okay, it's all wonderful until you need to check a bank statement or something. You're like, oh, great. Or you need to order an Uber, and it's hard. It's hard. The modern world is structured to for you to have it. Um, so yeah, I got no answers for anyone on that front.
Well, I'm hopeful that you're able to find a good balance between the two.
Well, fingers crossed. I mean, my biggest takeaway from this is actually the balance seems to be the path to sort of sound mental health. And yeah, I mean, I've learned loads talking to you, and I think there's I mean, we've covered a lot of ground and some really productive things. Um, so I just want to thank you so much for coming on. I really enjoyed that. And where can people find you? If where can we follow on? If
Uh,
that is even a thing you can do.
I'm on LinkedIn, and I don't really post very often, but that's one way for people to find me.
Wonderful. Well, Dr. Mitesh Patel, thank you so much again, and hope we do this again.
Thank